So today I want to talk about compression of the spine and how that affects the way your back feels. So anytime you have any pain at all in your back, low back, mid back, upper back, it doesn't really matter. Compression of the spine could be playing a role. And also, if you do some things to decompress your spine, it will probably help. That said, there are many reasons that you might have back pain, especially if it's chronic pain, it's been happening for a long time and you haven't gotten it checked out. It's always a good idea to go to your doctor, find out what's causing it. If there's a medical reason for the pain, you want to treat that medically. However, if you have turned over all of those stones, you haven't really found a chronic condition or a specific injury that's causing the pain, it could be just that your spine is compressed and the muscles around the spine are then becoming tight and rigid because of that compression. So, how does compression of the spine happen? Largely because we sit too much, right? So when you're sitting, when you find a comfortable position to sit in for long hours, you generally don't find length in the spine, right? So we're generally not using our core when we're sitting down. Now, it is a good idea to learn how to engage the core, learn how to have good posture and decompress the spine, even in the seated position, so that you can feel healthier and happier in your back. You can also compress your spine standing, right? So if you're standing a lot or standing all day, you might find ways of sitting back into your heels, just something that makes it a little easier for you to stand up, but that can also cause compression of the spine. So compression of the spine really just means that the bones, the vertebrae, are getting closer together and pushing on the discs, right? So that can cause bulging discs, but also it can just be slight, and it can just cause all of the muscles surrounding the neck, the shoulders, the core, and the low back just to become rigid. And then that connective tissue surrounding all those muscles also becomes rigid and tight, and then it's harder to move, right? And that lack of movement, that rigidity and the tightness is what inevitably causes the pain to persist. So if you think this is you, feel free to reach out to me. I'm happy to help. You can book a session or just book a free consultation, info@julieturnermovement.com. You can reach me on Instagram @JulieTurnerMVMT or Twitter @JulieMovement, or hit the subscribe button on my YouTube channel and get notified when lots of videos come up.